So I'm going to just talk a little bit about the male pelvic floor. The male pelvic floor has several important functions. It's really important for urinary function, particularly the anterior or front part of the pelvic floor. It's really important in men for bowel function, and that's predominantly the posterior or back part of the pelvic floor. It's also important for erectile function, and that tends to also be the front part of the pelvic floor. And I think men sometimes aren't maybe as aware of the roles of the pelvic floor. The pelvic floor is also important for stability of that pelvic region. So we'll just talk a little bit more about what exactly it does in men. So the posterior part of the pelvic floor wraps around the rectum, and that forms the outer or external anal sphincter. And that helps to keep us continent, but also when we want to do a bowel movement, it should relax fully. If it's not relaxing fully, which is sometimes the case in a lot of men, that can lead to or contribute to constipation, discomfort on doing a bowel movement, straining, or this feeling of incomplete emptying. You do a bowel movement, but you don't feel you've kind of done one fully. In terms of urinary function, we have the bladder, and then below the bladder is the prostate, and then passing from the bladder through the prostate, down into the pelvis, out through the penis, is the urethra. And the urethra passes through the pelvic floor at the front, the pelvic floor wraps around it, and that pelvic floor forms this outer or external urethral sphincter. So that pelvic floor is important for urinary function in men, but sometimes if that sphincter gets a little bit overactive, it can contribute to symptoms such as hesitancy, kind of difficulty initiating urination, frequency, going more often than normal, or urgency. And then I think what people find surprised is how important the pelvic floor is for erectile function. So the base of the penis, kind of underneath in that kind of soft area, which is the perineum, kind of that area between the scrotum and rectum. So in there where the penis starts, we've got two big muscles on each side. The bulbospongiosus or bulbocavernosus in the midline, right and left, and the ischiocavernosus, which is more on the side. And those four muscles are really important to help get an erection. They help to maintain that erection, and they're also important in ejaculation. Thank you very much.